Welcome to This Explainer. Today we're zeroing in on a total paradigm shift. We're talking about why financial literacy is absolutely a clinical competency skill. Look, we are moving way beyond just pumping people up with motivation, and we're getting into the systemic infrastructure you actually need for your career to survive and thrive. We're going to kick things off with a pretty shocking revelation that came out of the World Bank Group Youth Summit. The researchers there presented some findings that literally stopped the room, and honestly, it might just change how you view your entire professional trajectory.
All right, let's look at this wild gap, 85% versus 45%. The researchers found that globally, a staggering 85% of workers say that being able to prove their skills is absolutely essential to moving forward. I mean, we all know we need to show what we can do, right? But here's the kicker. Only 45% actually have access to a system that makes that proof visible to someone who has never met them. Think about the gravity of that for a second. More than half the global workforce is essentially invisible to the market. They have the skills, but absolutely no way to show them.
So, that brings us right to Section 1, the global visibility gap. Subtitle, When the Market Cannot See Your Skills. We've really got to ask ourselves why so many highly skilled, dedicated professionals are flying completely under the radar of the people who hold the keys to their advancement. It all comes down to what we call skill legibility. Basically, this means having the infrastructure in place to make the value of your skills readable and recognized by a total stranger without having to explain it from scratch every single time. Because, knowing deep down that your skills are valuable and actually having something tangible that makes that value legible to a stranger, those are two completely different ballgames. Let's move on to Section 2, the business loan reality. Subtitle, The Clinical Entrepreneur at the Bank. Let's see how this actually plays out in the real world. Okay, picture this. You've got a highly qualified nurse practitioner. Let's say she has 8 years of clinical experience, advanced dermatology training, and just incredible patient outcomes. Her patients deeply trust her. She absolutely knows her worth. But what happens when she walks into a bank to ask for a business loan or sits down with an investor? How on earth does she definitively prove those medical outcomes to a lender who knows absolutely nothing about healthcare?
Well, her worth is only as visible as the systems backing her up. We call these the invisible systems of legibility, things like a formal transcript, a recognized certificate, or an accredited formal program. Without these specific institutional backings that a lender instantly recognizes, they literally cannot see the skills she possesses. She shouldn't have to explain her entire career from day one every single time she walks into a room. And actually, that lack of a system, that is exactly what that 45% statistic from earlier really means.
This perfectly captures the disconnect we're dealing with. On one hand, you have knowing your worth, your clinical chops, your patient trust, all those years grinding it out. But on the flip side, we have making it legible, the institutional infrastructure, the visible proof, the recognized credentials. The harsh reality is that the institution that trained you probably never built the infrastructure to translate your clinical worth into market legibility once you leave the classroom.
And that lack of systemic education leaves practitioners completely blind to macro-level threats. Which brings us to Section 3, One Big Beautiful Bill Act. Subtitle, The Legislative Battlefield of Nursing. This isn't just some abstract theory, folks. It has massive financial consequences. Right now, federal loan limits for nursing students depend entirely on whether advanced nursing programs are classified as graduate or professional degrees under the Department of Education. If they get labeled as a graduate degree, students get slapped with lower federal borrowing limits. But if they are classified as a professional degree, higher borrowing limits are restored, giving students a lot more financial flexibility. Let's track the legislative stakes for the One Big Beautiful Bill Act because this is literally developing right now. In the past, the Department of Education classified these advanced nursing programs as graduate degrees, lowering those limits. Presently, states and nursing organizations are actively fighting that decision in court. Now, the big date to circle on your calendar is June 11, 2026. That is when the House Appropriations Committee passes a bipartisan amendment to reclassify these programs as professional degrees. Looking ahead, this bill still has to pass the full House and the Senate to actually restore those limits, so nothing is final just yet. Which leads us straight into Section 4, The Cost of Systemic Ignorance. Subtitle, Caring for Others Without Career Protection. The stakes here just couldn't be higher.
Despite those massive legislative stakes we just talked about, there is a giant informational void inside the very institutions teaching these professionals. Look at this quote. Most nursing students do not know any of this is happening. They are completely in the dark. That is the true heavy cost of a profession that trains people so incredibly well to care for others, but completely fails to teach them
how the systems around their own careers actually operate.
And this brings us to Section 5, our final paradigm shift: infrastructure, not a bonus. Subtitle: The Demand for Systems. We absolutely have to reframe our clinical education.
Here is the absolute core takeaway for today's explainer. Financial literacy is the infrastructure to understand decisions before they are final, so you can engage, respond, and build. We have got to stop treating financial and systemic literacy like it's just some cute little bonus module tacked onto the end of a syllabus. It is the mandatory infrastructure required to build a resilient career. It's the only way a practitioner can understand what's being decided about their future and actually build something in spite of it.
Going back to those researchers at the World Bank Group Youth Summit, their message to schools was loud and clear. Just look at this quote: "Financial literacy is not a bonus module. Young people do not want motivation. They want systems." Students are practically begging for the infrastructure to understand the corporate, financial, and legislative worlds they are walking into. Educational institutions need to step up and supply that infrastructure right now.
So, I'm going to leave you with this to chew on long after this explainer ends. Are you equipped with the systemic infrastructure to make your clinical worth undeniable and legible to the world? Seriously ask yourself, are you just building your clinical skills in a vacuum, or are you actively building the systemic armor to make sure those skills are recognized, legible, and protected? Thanks for joining me for this explainer. Keep learning and make sure you are building those vital systems.